for a long time, the physicians have visited their patients in hospital. And I'm a researcher looking at continuity of care and continuity of care from the hospital to the community, and I wondered if, where the primary care physicians know whether their patients are in hospital, does that help the continuity of care when they leave hospital? And then I thought back to when I was a kid, and my father, who was a family physician, he was an old school family physician, a solo practitioner. Somehow or other he would know that his patients were in hospital, I don't know how. But we would always go on, when we would go on errands, there would always be a slight detour that he would not always tell us about, and we'd wind up at the doctor's parking lot at the hospital, where he would go in and visit his patients in hospital. 2, 3, 4 patients at a time, depending on who was in hospital. One thing that made an impression on me was really how much those patients appreciated him coming and appreciated that friendly face and appreciated that familiar face. But when I thought about it from a scientific perspective and from the research that I'm doing, I was wondering whether by him knowing they were in hospital and by him advocating for them while they're in hospital, were these patients getting better care and were they having improved care when they left hospital? So that really was the impetus for why I wanted to start this line of inquiry. So we looked at about 160,000 patients from 2008 and 2009. And we only focused on those patients whose family doctors visited people in hospital. So if your family doctor never visited somebody in hospital, we didn't examine those patients. And then we compared the patients whose family doctors saw them in hospital to patients whose those same family doctors who didn't see them in hospital. Overall, about 12% of people were seen in hospital, and we compared those people for their outcomes when they left hospital, those that were seen by their primary care physician and those that weren't. We saw that for patients that were seen by their primary care physician, overall these were sicker patients, and after adjustment, so even the sicker patients had a lower risk, about a 12% lower risk of death, emergency department visit, or hospital readmission in 30 and 90 days after discharge from hospital. What we also saw, interestingly, was that those patients that were seen by their primary care physician had increased access to community supports like home care and primary care visits than patients that weren't seen by those same primary care physicians when they were in hospital. So we evaluated both home care visits and primary care physician visits after hospitalization, and improvements through home care or access to home care or earlier access to home care or follow-up care might be some of the ways that we prevent people from returning to hospital, improving that continuity of care, and improving their recovery after hospitalization. What we feel that this type of visit induces is that improved communication during the hospitalization, improved communication between providers, and then improved communication after the hospitalization, even recognizing that there might be earlier follow-up, there might be better follow-up, there might be more informed follow-up. There are some potential policy implications for the findings. So sometimes people debate whether or not you should incent people through addition of a new fee or a trial period. Here we already have an existing fee code, a fairly nominal fee code at $20, and overall that might cover a little more than the parking fees. So on the face of things, a $2.5 million outlay for about a 13 million person province is not a lot as compared to some of the other interventions where we would see a larger spend for not as significant an effect size. Essentially, we're looking for the value for money or bang for the buck that would be improved for this.